Morning, you guys, it's Karen, and I wanted to come and do an update on Watson's health because wow, there's been so many things gone on with him, and I wanted to tell you why we are no longer feeding raw, what's going on with his joints, what's going on with his tummy, what's going on with his allergies. So sit down and have a cup of coffee with me. I have got a coffee here, but I won't be slurping it on screen, don't worry. And why we're no longer feeding him raw is to do with his stomach as well. So let's start with the allergies. He has had allergies all of his life, and it was fairly well controlled with Apoquel, and then we discovered Cytopoint, which is an injection, and the combination of Apoquel and Cytopoint seemed to have him perfect. He didn't ever seem to bother. I gave him his allergy wash once a week and everything was fine. However, he suddenly started getting really bad ear infections, and so we went back to the dermatologist. The dermatologist told me that he shouldn't really be on Apoquel and Cytopoint, that they both more or less do the same thing. So we decided to stop Apoquel, but we were extremely nervous because we had tried to stop Apoquel before and Watson had been extremely itchy. But for some reason we stopped it this time and he was absolutely fine, and he seemed to get his energy back, and it was just wonderful. Please note, I know that there are people out there that don't agree with Apoquel, and there are people out there that don't agree with Cytopoint. I have looked at all of the research, I've looked at all of the things that have happened, the horrible things that have happened with dogs, and I personally cannot find anything that directly points to either Apoquel or Cytopoint as being responsible for dogs' deaths. I think it's awful what's happened, but like I said, I cannot find a connection due to the way that they work, and like I said, the research that I've seen. I'm not saying that they are the perfect drug, and I'm not saying that things might come out years later, but I satisfied myself with the safety of them balanced with the benefit that Watson got, because he had no quality of life when he had allergies, and Apoquel and Cytopoint both did wonderful things for him. And I know there's a lot of people that feel the same. There is an actual Facebook group that I was part of, which was something like I hate Apoquel and Cytopoint, you know. There's a lot of sites like that, and there were people on there saying, you know, unfortunately I've had to put my dog back on it because they were miserable. Every drug comes with a risk, and so like I said, I'm not saying there's no risks to either Apoquel or the Cytopoint injection, but Cytopoint is only on the edge of being a drug. It's actually a protein, so it's more of a natural thing, and Apoquel, like I said, there isn't a direct correlation with any deaths or anyway, that's all I'm going to say about that. But we were happy to have him off it because we knew that it did make him lethargic. And we always said we wish we could ask him, you know, would you prefer to be really itchy but full of energy, or a bit lethargic but not so itchy? And life just seemed better for him on Apoquel. But taking it away, he's been bouncing around with energy, he's been having the Cytopoint, and that's working for his allergies, combined with me using Maloseb shampoo once a week. So you wash his skin, leave it on for a bit, and then rinse it off. However, the ear infections were still really bad. The dermatologist gave us anti-yeast tablets, and he's on a weekend schedule of those. So on a Saturday and Sunday he gets a quarter of a tablet morning and night, so a total of 2. They're called fungiconazole, and they are anti-yeast tablets because yeast is the problem in his ears, even if I clean them and can't see anything. The other thing he suggested was steroids, and at the time we didn't put them on. He gave us steroids, he gave us instructions. I didn't put him on the steroids because Watson's stomach was upset at the time, and I'd forgotten to mention that to him because he was a dermatologist, but actually it wasn't the right thing to do. And I then later discussed that with my vet, and she agreed you can't go on steroids if the dog has an upset stomach. So I was pleased, because I was actually nervous that she was going to tell me off that I didn't follow the dermatologist's instructions. But we then had lots of other things happen kind of just before Christmas. He got a cyst on his paw. You may remember he was limping. He then got more cysts on his paws. They just seemed to be popping up everywhere. His paws were a mess. His ears were really bad. He's got lumps all over. He's got an elbow lump. He's got a lump on his scar, so kind of on his armpit on the other side. He's got a lump on his toe. At which point we realised that steroids might be helpful, because it was a month's course, and they said a month's course of steroids could just bring everything down. It can bring down what's called IL-1 and interleukin-1, which is is it 1 or 31? One's one that Apoquel works on, and one's, anyway, it's a inflammatory pathway. And just a small short course of steroids can bring that down to a lower level so that he doesn't have these recurring ear infections and lumps and bumps all over the place. Because with the paws, you can end up needing a paw fusion, where they need to take all the skin between the paw pads away and fuse all the paw pads, and it's a horrible operation. So obviously we want to avoid that. So despite not being keen on steroids, we started him on steroids a week and a half ago. But unfortunately, he was already, not unfortunately, but he was already pretty much better before we started him on the steroids. I've got his ears to being pretty good with my routine of, I use Otidine cleaner on one day and then Resicort steroid drops on the other, and then I clean them out. And then on his paws I use a topical steroid cream, and I wash his paws after particularly muddy walks and as much as I can, you know. And the lumps and bumps seem to have disappeared in themselves, so the lump on his skull went. So there wasn't much quantifiable we could see with putting him on steroids, but we thought, well, maybe it will sort his digestion out because his digestion wasn't perfect, and maybe his ears will stop bothering him because when I clean them, he yelps if I touch his ears. And maybe his paws won't be red at all because normally I can look between the paw pads and they're red. But I have to say, we didn't notice a huge difference him being on steroids, other than the side effects of the steroids. The first 3 days weren't so bad. We could see he was more thirsty, but then it was just ridiculous. He wants to eat everything in sight. He even tried to eat a dried poop yesterday, which Watson has never been into that at all. It's never been his jam, and that was not nice to watch. He's scavenging, so he's eating things that are upsetting his tummy that we can't even see before he's eating them, you know, and we're like, oh my God, what was that? So that in itself wasn't good. He's drinking so much water, it's ridiculous, and he's peeing so much. Not so much of a problem. But then he's also been doing this sort of crying and whining thing, which actually, speaking to the vet this morning, she said that was fairly normal being on steroids. But we didn't like it, you know, and we were like, these side effects would be okay. You know, he's putting on weight, and these side effects would be okay if we saw the benefit. But we aren't seeing a massive benefit, and you would see the benefit in the first 3 or 4 days because as of the last 4 days, he's been on half the dose of what he was on the first week. So you start a week, 1 tablet twice a day, and then this week is to be 1 tablet once a day, then it was to be once every other day. And so we should have seen the benefit in that first week, and we just didn't feel we did. And so it's like, why would we continue giving him something that it may affect his liver, may cause him problems, when we're not seeing any benefit? The side effects are actually upsetting his stomach because he's scavenging things, which he wouldn't normally do. Well, apart from barbecues, he does love a sausage. And so I phoned the vet this morning and discussed it all with her, and she said she was quite happy for us to stop the steroids now. So I'm just like, oh, it's amazing. We've got to give him 1 more tomorrow. Miss a day, give him 1 more tomorrow, just so that he gets back into the regularly producing them, okay? So that you taper off a bit. And what was I going to say there? Oh, she's quite happy with us stopping them. What we didn't discuss was what we're going to do about his ears and what we're going to do about his paws, etc. But I think we've just got to now keep an eye on it, and I've got to work really hard and make sure that I clean them constantly. You know, I clean his ears as much as I can. I say as much as I can because I don't want to do it daily. I want to try and get into a routine where I can do his ears on one night, like do the cleaner, clean them, put the steroid drops in 1 day so that he has time off. Because can you imagine, you have to fill up the dog's ear canal. I didn't know this until one of the vets told me last year. We used to put like a couple of drops in the ears. That's not what you're supposed to do. You have to actually squeeze it and put 1 ml. We use a little syringe now and fill up their ear canal because their ear canal is a different shape. But can you imagine what it feels like having your ears full of water? Watson hates it. He's really in a lot of discomfort anyway, and so that's obviously really uncomfortable for him. And so I'm trying to do it enough that it will keep his ears under control, but not so much that he's really fed up with having his ears touched every day, you know. And then with his paws, I can wash them as much as I can, as much as he'll tolerate because he hates it, and put the cream on when necessary. Hopefully that will keep his allergies under control. We'll continue having the Cytopoint injection. We'll maybe add in Apoquel as and when needed. But now it's just a case of seeing how he gets on. His allergies. For his joints, we know he has some kind of problem in his hip or knee, but we're not 100% sure what it is. And it's so sporadic that it never becomes a huge problem, but it's something that's always in the back of my mind. So I discussed it at length I had an hour's appointment with the vet to discuss everything about Watson, and we discussed it. And he gets a limp about every 3 to 4 months, he starts limping, and he just stops and holds his back left leg up like this. And then after probably about a minute, he puts it back down again and speeds off like there was nothing ever wrong. So it's indicative of like a kneecap not being firm, but they've checked that, it's in place, it's firm, everything's fine. And so there's a little bit of history here in that we'd mentioned it to the vet because he's had this since he was a puppy pretty much, since about 6 months. So we're talking 4.5 years now, nearly 5 years he's had this. And we had an x-ray done while he was having a lump removed, and it came back as having hip dysplasia. We could have sent it to a specialist at the time, but we couldn't afford it because it was an extra £100. A year later, when Kevin started working again, we paid £100 and had the specialist report. That report told us that the x-ray wasn't done right, but that what they could see from it was it did look like hip dysplasia. So you may remember, if you've been with me for a while, we then took Watson swimming and gave him anti-inflammatories. Where if he did limp, I gave him lots of different supplements. I did physio with him. Fast forward to last year when he got the tumour, we said, being as he's having the tumour removed while he's under sedation, can you do another x-ray of his hips so that we can find out whether or not he's got arthritis? Because, you know, that was my concern. They did an x-ray, we sent it to the specialist, and it came back and said he doesn't have hip dysplasia. So he was diagnosed with it. As far as we were concerned, he had it for a couple of years, but now we found out he doesn't have hip dysplasia at all, and they have no idea what's wrong. So we left it because obviously he had a tumour. That was our main thing, was to get him over the cancer, which we have now done. This week we've got his 1-year cancer check. But I discussed the issue with the vet because a couple of times I went in to the vet. One of the times when he had the hemorrhagic gastroenteritis, one of the vets had felt his knee and said it was inflamed, and then my normal vet now, Alex, checked it and she said yes, his knee's inflamed. So we don't know why, but it may have been his knee all this time, it may not have been his hip, but it's still not severe enough to put him under sedation and get an x-ray just for his leg, because he now hasn't limped since, I think it's October was the last time he limped, and we're now in nearly February. I did notice when I put him on the grooming table the other day that his back left leg was slightly shaking, so I am going to point that out to the vet next time I see her. But basically, with Watson's complex history, we know that at some point he'll need to go under sedation. He may be needing an endoscopy. And if he does, we'll say, while he's under, can you x-ray his hip and knee and take it from there? Or if it becomes a bigger problem, if he starts limping every month or something like that, you know, then we'll take it further. So that's his joints. Currently, we're just going to keep an eye on it. I've got him on a supplement that I can't think of the name of it. What is it called? It's not Shark. It's Green Lipped Muscle. That's the one the vet recommended, the only one with evidence behind it for joint problems. So he's on that. I'm keeping an eye on it. We're probably going to start him swimming again. He doesn't love swimming, so we'll probably only do it once a month. But that will help with his weight loss after being on the steroids as well. He's put on weight. So yeah, that's his joint pain. And then finally his stomach. He's had colitis since he was a puppy. And we know exactly what started it off. He swallowed a piece of slate about this size with jaggy edges. We didn't know that until I saw it come out after, I think, my 3rd visit at the vet, where he'd been crying in pain and he wasn't eating, he wasn't drinking. It was absolutely horrendous. He was about to go into hospital, and then he pooped this stone out, and he started to get better after that. But what never recovered was his bum. He had bloody diarrhea for the first year of his life. But the vets that we were seeing at the time, it was the same company, but it was the people, it's been taken over since then. They basically just said, you need to go away and find the right food for him, which we eventually did, and we found raw. We gave him raw food, and overnight he had his first firm poop, which was a year later after getting him, you know, and we were like, yay, this is amazing. And that worked for us for a long, long time. Then he got Campylobacter poisoning. You can see how much this poor little guy has been through. And after that, the raw food just wasn't healing him. You know, he had 6 weeks, I think the Campylobacter lasted overall, in that he didn't feel well. He didn't eat for 2 weeks of it, and then he was on antibiotics and different antibiotics and all that kind of thing. But then when he started healing, his bum just wouldn't go back to normal again, even with that raw food. So we kept trying lots of different foods, and finally we found another one that worked, another raw food that worked for him. But the same thing has happened with him getting this hemorrhagic gastroenteritis. in that we just couldn't get his bum back to normal again. And that's why all of these tests, that's why potentially we need an endoscopy, that's why we've been waiting for the blood test results of his pancreas. That's what they're testing, how his pancreas is working. She's saying, you know, perhaps there's something over the years that's been happening. The blood tests, I spoke to the vet this morning because I was speaking about the steroids, and she said, well, while you're on the phone, I might as well give you some of the blood test results. She said, I'm still waiting for the B12 and folate, but I can give you the results of the pancreas screening. It is negative. And so I said to her, that's absolutely fine, and we'll wait and see about his B12 and folate. However, I don't want to go on to the next step, which is endoscopy. Kev and I have spoken about it a lot, and the reason we don't want to is because we've seen a lot of firm poops from him lately with another food we've found, which is an air-dried lamb casserole. And so it's as close to raw as you can get. It's natural food. We're also giving him a little bit of Bella and Duke raw beef, which is help him. And it's like sort of crunchy pellets, whereas the innocent pet one, the innocent hound one, is soft. It's actually like treats. He absolutely adores it. And that seems to have been showing some results. She did agree with that, and she said there's no point doing an endoscopy on him if he's having firm poops because it won't show anything up. She said, but don't rule it out completely, because I was saying to her, you know, I don't want him to go through anything else and blah, blah, blah. And she says the only concern is, she said, this will happen again. There's obviously something underlying there, and he will have another bout of diarrhea, he'll have another infection, and at that point, he will go straight to endoscopy to find out what's going on, you know, rather than... we won't need blood tests, we won't need to send his poop off and all of that kind of thing that we've had to do this time. It will be straight to endoscopy. So that's really good to know that at least if it happens again, I've got a funny feeling they would ask for a poo sample anyway, just to check that it wasn't worms or anything, you know. But it's good to know that we wouldn't have to go through all the blood tests, and we could just say, right, let's get him booked in for an endoscopy. But I think that we can control it with food. And so the reason we're stopping raw is because, like I said, it's just not working, and we could try and find another raw, but we've tried a few with him and he just wasn't keen on them. I was finding it quite gruesome. The Bella and Duke tubs were looking very, very bloody, and it was really putting me off. When we started this whole raw journey, I was using the Nature's Menu chunks, and they're fine. You know, they weren't as gruesome, but raw meat is something I've struggled with myself. I've never cooked raw meat until the last sort of year or so. I've probably got more used to it because I'm giving it to Watson. Before that, I had never touched raw meat. I was a vegetarian for a long time, and even when I wasn't, I just wouldn't touch meat. I'd be happy for somebody to cook it for me, you know, as long as I didn't see it. So that's a big part of it as well. But as Kev and I discussed, no matter how good raw is and how many great experiences we've had with it, there's no denying that there'll be an element of bacteria in there. You know, there's no denying that there's a bigger risk of getting a bacterial infection from raw food than there is from stuff that has been highly processed, which is kind of the reason I didn't want to use it, i.e. kibble. But like I said, with this air-dried stuff, it's kind of a happy compromise, I think, for me. He seems to love it. His digestion, from what we can see, seems to love it. It's good food. We've got a couple of kibbles. We're not just giving him this air-dried food. We are giving him kibble in the morning, which is a digestion special one. And we've got a couple of other options. R2 is another one that we give him, the R2 duck, because that's quite high protein. So yeah, that's why we're not using raw. The risk of bacteria, he's had, you know, too many infections. We want to eliminate as much risk as possible. The gruesomeness, and because it's me that has to get his dinner ready, and it's just not very nice. And the fact that Watson is loving this new food as well is really, really good. And it's also more convenient because this we can now take on holiday, and also you can leave this out. Doodles tend to be grazers, and I can now leave this food out and he can eat it whenever he wants. Whereas with the raw food, if he didn't eat it within half an hour, I'd either hand feed it to him, which sometimes he did eat, or I would just throw it away, and it was such a waste of food, you know. So yeah, for his tummy, we're waiting for the B12 and folate test, but I don't think they'll show anything up. I believe they're going to be negative because that's to do with absorption. And yeah, I think Watson absorbs okay. Otherwise, there wouldn't be these little firm poops in between all of the episodes. And so nothing else planned for the future for him other than to try and give him the best food possible. What I mean by that is make sure that the things I use in his enrichment games are not things that have got too many, you know, sugars and things like that in, or preservatives, etc., etc. You know, buy as good a treats as we can afford. Continue what we're doing and hope for the best. I don't think it's going to be a straight line. You know, it's not going to be an easy I mean, he's not going to have a year of not going to the vet. You know, I'm looking forward to getting to the cancer centre and getting our 1 year clear. I believe that he will be clear, but we'll still have to go back there every 3 months until the 18-month point, and then it's once every 6 months, because it is a cancer that comes back pretty quickly, or pretty commonly with this type of tumour. It's the mast cell tumour. So I'm expecting 2020 to be a year of health for him, but like I said, I don't expect it will be a straight line. There will be problems, but I am going to be checking every single inch of him to make sure that I find them. I feel like I say that a lot and then something comes up and I've missed it. The things that I've missed are when I took him to the vet when he was air licking, we checked his mouth, inside his mouth, but they've got these lip folds, and there was a benign tumour in his lip fold and it was all infected and it looked hideous, and we felt really guilty that we hadn't found it. And more recently his paw, you know, he was limping and I checked his paws, but I just couldn't see it. But then when the vet found it and showed it to me, it was like glaringly obvious, you know, and I was like, we were both like, how did we miss that? How? It's right there. And I did his paw pads, you know, I'd been sitting in his paws, but he's got a lot of hair, I suppose. But anyway, I'm going to stop rambling now. I hope that was interesting to you. The reason I do these videos is not just because I want to tell you about Watson, because I know there will be people that are interested to know how Watson's getting on, but also I know that a lot of you are going through some of these issues, and it will be useful to you to know what I've been through, what's worked for Watson, what's not, you know, and feel free to ask any questions about any of the things I've mentioned today. So thank you very much for your interest. Thank you so much for watching, and I'll speak to you again soon.